Hi, I'm Dr. Bishop from Animal Healthcare, and today we're going to talk about treating dog allergies. Judy's going to ask me some questions. I'm going to answer those to the best of my ability, and with that, I'll give it to you, Judy.
All right, great. So, Dr. Bishop, how will a veterinarian test my dog for allergies?
Well, with allergy testing, there's a couple of different modalities. Usually, I will refer the patient to a specialist, a veterinary dermatologist, and generally they will do intradermal allergy testing, which means giving injections of the thing that the patient's allergic to. They use a standard, which is histamine, that they inject into the skin. So they inject small amounts of allergies in the skin, and then they measure the reaction that occurs on the skin as a swelling of the skin. Allergy testing, blood allergy testing, is another agreed upon modality for allergy testing that can be used for environmental allergens. There is no allergy testing for food allergies. All food allergies are basically diagnosed by the elimination of all allergens that the dog has not ever been exposed to. So if the dog is a dog that eats from the table, has had everything under the sun to eat, but never had buffalo in his past or never ate alligator in his past, then we might put him on an alligator and potato diet or buffalo and potato diet or something like that. But then nothing passes that dog's lips for a minimum of 3 months. And if the dog's allergies have settled down really well, then we can go back and challenge the dog with, let's say, a chicken diet or something like that. So we've got injectable methodology for testing for allergies, serum allergy testing, and then for foods, it's always food elimination diet, where we put them on a novel protein because it's the proteins in the diet that are concerned.
Okay. And then how soon will I get the dog allergy test results?
Well, the longest one is, of course, the food allergy testing, where it could take at least 12 weeks or 3 months before we really see significant and stable improvement. When you take your dog to the veterinary dermatologist and they do intradermal testing, it's a matter of an hour or so until they read it out and give you a list of the answers. When you send the serum off to the lab, it's probably a week to 10 days turnaround time until we get it back.
Okay. And then what are the common treatments for dog allergies?
Well, a lot of dog allergies are being treated in an undiagnosed fashion. So today we have drug modalities that we use like Apoquel and injectable modalities like Cytopoint that have really kind of revolutionized and made life a lot easier for both the veterinary dermatologists as well as solo practitioners, individual practitioners out in practice that are not specialists. For example, years ago, we used to use prednisolone, which had a lot of side effects, and would block the ability of the dermatologist to go ahead and do their allergy testing. Now we can use a drug like, or an injectable like Cytopoint. And as far as I know, it doesn't block and doesn't have to be stopped before we do the allergy testing. But we check with the individual dermatologist. Years ago, we had to stop all the antihistamines, stop all the steroids for multiple days. The dog would get miserably itchy. But now a lot of times the veterinary dermatologist will allow us to continue some of those drugs.
Okay. And then how are flea and insect bites on my dog treated?
Well, they're treated with anti-inflammatories if indicated. The bigger issue is if there's a flea infestation, we need to control that infestation. And all of that was quite a grocery bag of stuff that went home with people in the 90s. Today, it's pretty simple. We pretty much give an oral medication or a topical medication, which kills the fleas and ticks. We don't have to bathe and balm and dip and balm the house for the most part, unless the family members are being affected by the fleas. But it's usually removal of whatever it is that's biting them or removing them from the environment where they're being bitten. And when I say that, fly bites, for example, on the tips of ears of dogs are something where, yes, we can put a topical on there, but if the fly population is really, really hungry and really, really aggressive, we pretty much have to remove the pet from that area. We also run into situations where, even though we're treating the dog for fleas with a very, very effective product, if, for example, we've got a whole congregation of raccoons that live under the owner's deck, and the dog goes outside and sniffs around underneath of the deck, and the raccoons are flea infested raccoons, they're going to get a lot of flea bites when they go outside. So sometimes we have to do some environmental control too, or remove the raccoons and environmental control. So it really depends.
Okay. And then what medicine is safe for dogs with allergies?
Well, there are quite a few safe medications out there. A lot of the antihistamines that are used in people can be used in dogs. We in the veterinary industry, again, go to the more recently developed drugs. The Apoquel is a Janus kinase inhibitor, which is very safe in dogs. Long-term use of corticosteroids, not a safe move. Short-term use to calm down a very, very irritated dog's skin. If the skin's super irritated, a short course of steroids is okay in most patients. If the patient's diabetic, there's going to be some problems with it. But other than that, I mean, for the most part, a short course of steroids would be beneficial in calming down the situation.
Okay. And can I give my dog Benadryl for allergies?
You sure can. Certainly can. It needs to be given probably 3 times a day to really be effective. And most owners, either the dog gets tired of being pilled 3 times a day, or the owners just can't really work it into the schedule. But if the drug levels in the body fall too low, then obviously the drug's not going to work very well for the prevention of the allergy manifestations.
Okay. And are there any holistic options for dog allergies?
Not being a holistic practitioner, I don't want to say that there are not, because I'm probably sure that there are some holistic measures out there, but I personally am not aware of any.
Okay. And last question, is there anything I need to do in my home environment for my dog's allergies?
Well, I think it's a good idea to not feed your dog a whole bunch of different types of proteins, to try to reserve some proteins and make sure that we have some that particular patient hasn't been allergic to, or hasn't been exposed to in the event that he develops food allergies. So limiting the food types. The other thing is sometimes house dust mites will tend to get a large congregation in a dog bed. So if the dog has allergies and they seem to be manifested a lot, sometimes by changing out the dog bed, literally changing it out, because washing the covering doesn't get rid of any of the mite dander and mite allergen that's in the mattress. Sometimes changing that out is really helpful. Certainly good grooming, which isn't really a house-related thing, but is a dog-related thing. Keeping the dog mat-free, debris-free is going to help with allergies, because if he's got a contact allergy that's from, let's say, he goes out in the garage and there's some oil on the floor and he lays in the oil and he's got a contact allergy to oil. So keeping the environment, overall tidy and clean is really helpful. There are also contact allergies that can occur from, you have the people come in and clean the carpet, for example, and I don't necessarily know that we want to call them allergies, but they're intolerances, they're things that irritate the skin. So non-rinse floor cleaners, where the floor cleaner is left on the floor, residual soaps and things like that in carpet that's been cleaned can sometimes be an issue too. So again, rinsing the floor after you've used a chemical agent on it is always a good idea. And I guess with that, if anybody has any questions, feel free to give me a call here at Animal Healthcare. Our number is 630-305-7200, and our website's vetnaperville.com. So thank you very much today for listening to us, or to me, and being here.